Dementia, a video by Lao Senior Quality of Life Program. This project/program is funded in part through a grant from the Minnesota Board on Aging Dementia Grant. Dementia is a general term for when a person has developed difficulties with reasoning, judgment, and memory that are severe enough to interfere with their independence and activities of daily living. People who have dementia usually have some memory loss as well as difficulty in at least one other area, such as speaking or writing coherently or understanding what is said or written, recognizing familiar surroundings, planning and carrying out complex or multi-step tasks. Some causes of dementia include Alzheimer's disease, which is the most common cause, vascular dementia, which is damaged parts to the brain due to reduced blood flow, dementia with Lewy bodies, which is abnormal protein structures or Lewy bodies that form within the brain cells that cause characteristics of Parkinson's disease. Other causes include Parkinson's disease dementia, which occurs later in the course of Parkinson's disease, and frontotemporal dementia, which is nerve cell loss in a specific part of the brain, the frontal and temporal lobes. Other causes are mixed dementia, which is having more than one cause, such as Alzheimer and vascular damage. In addition to that, other causes would be cumulative damage to the brain over time due to chronic alcoholism or repeated head injuries. Some risk factors of dementia is age. It's most common over age 80, with 1 in 6 people affected between 80 and 85 years, 1 in 3 above 85, and about 1/2 of people over age 90. Family history is also a risk factor. Having a close family member with Alzheimer's disease increases your chances. The risk is highest if a family member developed Alzheimer's disease at a young age, less than 70 years old. Other factors include high blood pressure, smoking, diabetes, and lifestyle factors. People who remain physically active, socially connected, and mentally engaged seem less likely to develop dementia than people who do not. If you are high risk, continuing activities may produce more cognitive resilience, delaying the emergence of symptoms until an older age. Some symptoms of dementia include difficulty with memory, language, reasoning, and judgment, with varying symptoms from person to person. Symptoms may also change over time. The progression can vary as well. Some people will have symptoms of severe dementia within 5 years of diagnosis. Some can take more than 10 years. Mild memory loss is a normal part of aging, such as forgetting a phone number or set of directions for a short time, and do not signify a progressive dementia. Memory loss relating to dementia will start to interfere with a person's day-to-day functioning. Some early changes include confusion, trouble finding right words for things, difficulty with concentration and reasoning, Problems with completing tasks like paying bills or balancing a checkbook, and getting lost in a familiar place. Late changes of dementia include increased anger or hostility, sometimes aggressive behavior. Alternatively, some people become depressed or exhibit little interest. Sleep problems, hallucinations and or delusions, disorientation, needing help with basic tasks such as eating, bathing, and dressing, and difficulty controlling bladder and or bowels. Dementia and others, or in relation to others, the changes caused by dementia will likely stress relationships and make communication difficult. The following tips can aid conversation and help everyone feel better. And there is a link provided that you can click on to get more information. Some tips for communication. Set a positive mood for interaction. Your attitude and body language communicate your feelings and thoughts more strongly than your words do. Set a positive mood by speaking to your loved one in a pleasant and respectful manner. Use facial expressions, tone of voice, and physical touch to help convey your message and show your feelings of affection. Get the person's attention. Limit distractions and noise. Turn off the radio or TV. Close the curtains or shut the door, or move to quieter surroundings. Before speaking, make sure you have her attention, address her by name, identify yourself by name and relation, and use nonverbal cues and touch to help keep her focused. If she is seated, get down to her level and maintain eye contact. State your message clearly. Use simple words and sentences. Speak slowly, distinctly, and in a reassuring tone. Refrain from raising your voice higher or lower. Instead, pitch your voice lower. If she doesn't understand the first time, use the same wording to repeat your message or question. If she still doesn't understand, wait a few minutes and rephrase the question. Use the names of people and places instead of pronouns or abbreviations. Ask simple, answerable questions. Ask one question at a time. Those with yes or no answers work best. Refrain from asking open-ended questions or giving too many choices. For example, ask, would you like to wear your white shirt or your blue shirt? Better still, show her the choices. Visual prompts and cues also help clarify your question and can guide her response. Listen with your ears, eyes, and heart. Be patient in waiting for your loved one's reply. If she is struggling for an answer, it's okay to suggest words. Watch for nonverbal cues and body language and respond appropriately. Always strive to listen for the meaning and feelings that underlie the words. Break down activities into a series of steps. This makes many tasks much more manageable. You can encourage your loved one to do what he can, gently remind him of steps he tends to forget, and assist with steps he's no longer able to accomplish on his own. Using visual cues, such as showing him with your hand where to place the dinner plate, can be very helpful. When the going gets tough, distract and redirect. If your loved one becomes upset or agitated, try changing the subject or the environment. For example, ask him for help or suggest going for a walk. It is important to connect with the person on a feeling level before you redirect. You might say, I see you're feeling sad. I'm sorry you're upset. Let's go get something to eat. Respond with affection and reassurance. People with dementia often feel confused, anxious, and unsure of themselves. Further, they often get reality confused and may recall things that never really occurred. Avoid trying to convince them they are wrong. Stay focused on the feelings they are demonstrating, which are real, and respond with verbal and physical expressions of comfort, support, and reassurance. Sometimes holding hands, touching, hugging, and praise will get the person to respond when all else fails. Remember the good old days. Remembering the past is often a soothing and affirming activity. Many people with dementia may not remember what happened 45 minutes ago, but they can clearly recall their lives 45 years earlier. Therefore, avoid asking questions that rely on short-term memory, such as asking a person what they had for lunch. Instead, try asking general questions about the person's distinct past. This information is more likely to be retained. Maintain your sense of humor. Use humor whenever possible, though not at the person's expense. People with dementia tend to retain their social skills and are usually delighted to laugh along with you. Diagnosis. Memory and cognitive tests are used to assess a person's degree of difficulty with different types of problems. Doctors may order blood tests to find out if there is a chemical or hormonal imbalance or vitamin deficiency that could be contributing to symptoms. Brain scans, usually MRI and/or lumbar puncture to help identify the type of dementia. A good way to help take care of your loved ones is to form a healthy habit tracker. This could be monthly. It could be just recording daily tasks such as how much water was drank for the day, if you had watered plants already, or walked to work.